So this study was a part of the larger Atlas of Blood Cancer Genomes project, which is aimed at sequencing all of the hematologic malignancies that are categorized in the World Health Organization. But this project specifically focuses on mantle cell lymphoma, and we performed whole exome sequencing and RNA sequencing on a cohort of cases from all over the world and associated clinical data with those sequence specimens. So something that we were really interested to find is in patients who had p53 wild type, that is, they did not have mutated or deleted p53. We found that those patients did have a preponderance of ATM mutations, which has been described before. But what was interesting to us was that presence or absence of the ATM mutation in that p53 wild type population actually portended differences in survival, with the patients who were ATM mutated having poorer prognosis compared to the patients who had ATM wild type. Yes, so our data had quite a long amount of follow-up in the patients that we characterized, and so there was a significant difference with a p-value of, I believe, 0.035, where the patients who had a ATM wild type had about had better survival as far as we looked out, which was years down the line. So we had follow-up of 5-10 years in some of these patients. Yes, so there were patients in our cohort who had both a p53 aberration and an ATM mutation. ATM mutation was much less common in that group. We only saw it in about an average of 21% of patients. We haven't yet looked at differences in survival between those groups, but uniformly, people with mantle cell lymphoma that has a p53 deletion or mutation have a pretty poor prognosis in general. Yes, so those were some of the mutations that we also were found commonly mutated across our cohort. Our analyses are ongoing to see what sort of survival differences we may see among those cohorts. We saw meaningful differences in both progression-free survival and overall survival when we stratified p53 wild-type lymphoma by ATM mutation status. So people who had ATM mutations in that cohort had a shorter progression-free survival, a median of about 38 months compared to 138 months in our wild-type ATM group. And then similarly and somewhat surprisingly in overall survival, they also had a shorter overall survival at 104 median overall survival months compared to 138 months of median overall survival in the p53 wild-type ATM wild-type group. Right, so one of the upshots of our research, finding this ATM-driven prognosis in p53 wild-type patients, we need to validate this in other cohorts, but it does suggest the need to potentially clinically stratify these patients, and so we would be, we're anxious to see if this plays out in a clinical way and seeing if maybe we need to stratify our p53 wild-type patients by ATM mutation status to see if there's a clinical benefit to using certain therapies. So I would just like to highlight the exciting nature of the ABCG project as a whole. We have a few abstracts here being presented at ASH in other malignancies as well, but I think what our hope is that this will become a rich resource for many investigators to look at genomic findings throughout the spectrum of hematologic malignancies.